Dr. MeiLan, welcome to the Val DeBeebe Show live in Dallas, Texas. How are you today?
Great. Thank you for having me.
Well, you've got a great important topic I really want to hear your thoughts on. It says that the first of its kind medicine approved for chronic lung disease. First of all, what's chronic lung disease? Because we know the acronym COPD. Would you explain that to us?
Yeah, sure. So COPD, or chronic obstructive pulmonary disease, is a progressive disease that makes it really difficult for patients to breathe because of progressive damage to the lungs. But I'm here today in partnership with Sanofi and Regeneron to talk about, like you said, a new treatment option that's available for COPD.
Okay, so what does it mean when someone has, and I think I'm going to try this, encephalitis?
Yes, so eosinophils is a type of white blood cell. And we're learning it's a marker of a very specific type of inflammation that can help to drive flare-ups. We also call these exacerbations in patients with COPD. So these are episodes where patients suddenly get short of breath. But there is a new medication called Dupixent or dupilumab that targets eosinophilic inflammation, and it can really help to reduce the frequency of flare-ups in patients. Now, it doesn't replace a patient's inhalers, but used on top of inhalers, Dupixent can really help to decrease inflammation and decrease the frequency of flare-ups that patients have.
I want my audience to know I'm speaking to Dr. MeiLan Han. She has a lot of experience. She's a professor of medicine and chief of the Division of Pulmonary and Critical Care at the University of Michigan Health. I love Michigan, beautiful place. Okay, tell me who's at risk for developing COPD.
Right. So a lot of people think about COPD as being associated with tobacco smoke, and that certainly is a risk factor. But there's many patients with COPD who've never smoked. Maybe they've had repeated respiratory infections. Maybe they were exposed to secondhand smoke as a child, or even air pollution, things like that. So there's many things that can actually drive the development of COPD. We have a lot of treatment options already available. Many of them are inhaled. But unfortunately, these medications don't always provide adequate relief for patients. They're still having frequent flare-ups. So with the approval of Dupixent, particularly patients with high levels of eosinophils now have a new treatment option available. Now, like with any medication, there's always risks and benefits, and patients shouldn't take Dupixent if they're allergic to any of the ingredients. And there are potential side effects, including severe eye problems, joint aches, and pain. But the bottom line is that if patients have COPD, they should talk to their doctor, ask for a complete blood count so they can get their eosinophil levels checked, and find out whether Dupixent might be a good treatment option for them.
And if you have COPD, how does it impact your day-to-day life?
I'm sorry, can you say that again, Valder?
If you have COPD, if you've been diagnosed or you know you have it, how does it impact your day-to-day life?
Yes, so patients may have difficulty getting dressed. They're so short of breath. They may have difficulty even walking to the mailbox or doing daily activities. But, one of the other really frustrating things about the disease is that patients have these periodic flare-ups, which they don't know when they're going to happen. So it makes it really difficult to plan going to events, for instance, and really can impact the patient's quality of life.
And these treatment options, who's going to be recommended in? We'll go to a specialist or your primary doctor?
So probably the best place to start is with your primary care doctor, and you can certainly talk about treatment options with them. And they may refer you on to a specialist. If you already have a pulmonologist, that's a great place to start. But the thing that you want to ask them about is first, have you had a breathing test to confirm that you've got COPD? And then the second question, I think, is for patients to ask for a complete blood count to find out what their eosinophil levels are. And that's when they can ask them, either their primary care physician or their pulmonologist, about whether Dupixent might be a good treatment option for them. There certainly is also additional information. There's also additional information on the website Dupixent.com.
And overall, you want them to know that Dupixent is available for them to seek out some answers about maybe it will impact their COPD, correct?
So Dupixent is indicated for patients who have a very specific subtype of COPD where they've got elevated eosinophils. So absolutely, talking to their doctor is the best place for patients to start.
Dr. Hahn, thank you so very much for talking about COPD, and thanks for being my guest on the Valder Beebe Show.
Thanks so much, Valder.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.